everyone, and welcome back to another insightful episode of MedSynapse podcast series, where we break down real-world clinical challenges with experts across the globe. I'm your host, Hetvi, and today let's see how laparoscopic surgery has transformed the modern surgery practice: smaller incisions, quicker recovery, better outcomes. But let's be very honest, behind the elegance of minimally invasive surgery lies very real risks, blind spots, and technical pitfalls that can turn a routine case into a stressful one. And today we are talking about the common pitfalls in the laparoscopic surgery, more importantly, how every surgeon can avoid them. And to guide us through this discussion is Dr. Sonal Kumar, a general laparoscopic and robotic surgeon with specialized expertise in minimally invasive technique. Doctor is deeply passionate about precision, patient safety, leveraging technology to improve surgical outcomes while constantly evolving through learning and evolution. So, Doctor, it's a pleasure to have you today for this discussion and welcome to the show.
Hi, good afternoon. Pleasure is all mine.
So, Doctor, let's just begin with the discussion today. So, from your experience, what are the most common preventable pitfalls in laparoscopic surgery, and why do you think that they continue to occur despite formal training?
See, being very candid, I would like to say, as a very short and brief experience of mine, that we should never have that one word which we learn in all the field we are practicing is that God syndrome, that we cannot be wrong. Okay. So, before performing any procedure, we should be extra cautious. We should follow the book, like the textbook, how it advises us to go ahead. Per se, in laparoscopic surgery, the initial part of the surgery is a blind incision. So we put the incision and then we put a trocar inside to inflate the stomach. So we should be very precise and double sure before putting the needle inside, because that's a blind procedure. That is the most common area where many of the learning surgeons make mistakes, and they tend to injure the intestines, which we call bowel, and thereby a major incidence happens and the laparoscopy surgery is converted into the open surgery. So the primary step itself has to be taken with utmost precaution. Secondly, when we proceed ahead with the surgery, when we enter inside, we proceed ahead with the surgery, we should take a deep breath, re-channelize ourselves and think every surgery as a new surgery. Like, we have done over 2000 laparoscopic surgeries till date. So the one which I'm going to do again today after an hour, I'll consider it my first case. So if you consider all cases as your first case, go baby steps one by one. The learning graph will always increase and tend to make mistake will be minimalized. Complications are by hand of any surgery. What we should be confident enough is that any complication that happens on the table should be resolved on the table itself. That gives the quality treatment and better outcome of any surgery.
Yeah, I think that's so important, especially the gap between knowing the steps and actually executing them during the surgery is very important.
Exactly.
So, now, what mistakes during port placement and entry do you see the most often, and how can surgeons actually minimize this risk, especially in complex patients?
See, generally we face challenges in morbid obese patient, morbid obese who has a huge abdomen, and the patient who has undergone previous surgeries. So previous surgery patients, we tend to expect that all the intestines are adherent to the anterior abdominal wall. In those patients, we should be extra cautious, and instead of placing the ports blindly, what I practice is I put the ports under vision. So there is a specialized port known as Visi port. We tend to make a bigger incision in that, but nevertheless, the patient's safety is primary. So we go ahead with that, putting the Visi port. That is port under the, we place the port under the vision. So by this step, we can tend to prevent major aversions during these kind of procedure. And secondly, like I mentioned you earlier, that many young surgeons, they tend to just go with the flow and they don't take that patience while putting. Patience is the key of any surgery. You need to be very patient. Complications will happen. It is not that no matter how experienced you are a surgeon as, complications will happen. You should not lose your cool, because if you have a patient head, you will take wise decisions on the table.
Correct. I think I'm really glad that you emphasized how important this is from a surgeon's perspective also. So now, doctor,
Exactly.
usually we see that intraoperative bleeding is where many cases begin to unravel. So what technical or cognitive errors usually lead to loss of control, and what practical strategies help surgeons manage bleeding laparoscopically or even robotically for that matter?
See, even I have faced many surgeries in which intraoperative bleeding has happened. I'll
Mhm.
talk from my experience, like when I was into those shoes. Always call someone for help. If someone is there, always call someone for help. Asking a second opinion on the operation table will make you no less a good surgeon. Secondly, you don't need to lose your patience. Always apply pressure bandage. Like we make them, they are radio opaque gauges which we place inside for cleaning the area where lots of bleeding happens. So pressure technique is always good. Put the pressure on the area where bleeding is happening for good 180 seconds. Make a count of 180 seconds. Release it. Check if there is again bleeding. Then electrocauterize it. And if again the bleeding is not stopped, like I mentioned, the first thing, always seek help. There is no harm in seeking help. There is no harm in taking any opinion.
Right. I think that mindset alone can change the outcomes dramatically because there's no harm and it will in all improve the patient outcome also. So it's very important.
Like you mentioned about the robotic surgery, in
Mm.
robotic surgery, what we have the technical advantage is that we can rotate the instrument up to axis of 360-degree, what we can't do with our own hands. Though the instruments are being controlled by us sitting on the console, because of the enhanced 3D vision and better precision of the instruments, bleeding is comparatively very less when we go with the robotic surgery. But the only challenge what we see in our day-to-day practice is that it is not much cost effective as compared to laparoscopic surgeries. Otherwise, any day robotic surgery has a edging advantage over the laparoscopic surgery.
And in terms of safety also, I feel robotic surgery
Exactly,
is
yes.
more safe, yes. So now, doctor, energy devices are indispensable but frequently misused also. So, what are the most common errors with energy applications, and how can surgeons prevent delayed thermal inquiries?
See, any energy device which we use, the most important thing, like when we buy a camera for ourselves in our daily household, we tend to read the handbook of that, how it functions. We are not biomedical engineers, we are surgeons. So a biomedical engineer makes a device. They give the hospital that device and but also give a handbook. Take good 15-20 minutes to read about the instrument at first. No matter how experienced surgeon you are, how long you have been practicing, it's never bad to read. So if you read about the instrument, you will know how to handle it and especially how to troubleshoot it. So if you're not aware about troubleshooting a device, don't use it, because those are electrical devices. It will tend to malfunction. Unless you are not aware about troubleshooting it, you may land up in some difficulty now or sometime later in your life. And the most common mistake during using the electrosurgery is that we should know where to apply it. Because if we apply in a hollow viscous organs like bowel, stomach, so you'll tend to injure it, and then the conversion of laparoscopy or robotic surgery will go into open surgery. And any open surgery is a relative morbidity for the patient.
I think that's like a very crucial reminder for surgeons that you've given here.
Exactly.
Yeah. So now, doctor, conversion to open surgery is still viewed as failure by many surgeons. So how should we reframe conversations to conversion to prioritize a patient safety over surgeons' failure?
See, I have a very skeptical view on this. Like
Hmm.
during my post graduation training, also, I have done endless laparotomies. Those are open surgeries. So I still believe that conventional surgery, which are open surgery, is not a failure, but it is only done for ensuring the patient's safety.
Yeah.
And because the prime goal of any surgeon or any doctor per se, while they practice medicine or surgery, is that patient's outcome should be appropriate and quality of life should improve. No one likes to convert the surgery, but conversion is only done when something inevitable is there. So it's
Right.
not a failure. Conversion of the surgery is done per se for life saving. Otherwise, there are many surgeries which cannot be done laparoscopically or robotically. Even I advise many patients to go for the open surgery.
Yeah, I think I love that perspective that you shared, like calling conversional decision for patient safety is something every surgeon should know and needs to hear often. So thank you for sharing that. Now, doctor, looking back, what mistakes during your learning curve taught you the most, and what habits or systems do you now rely on to prevent repeat errors in your practice?
See, the most important mistake which I used to do was that I used to feel ashamed of taking a second opinion, like what someone will think about me in the hospital. So my when I was doing my post graduation, my guide taught only one thing: you have to learn till you die. So a
Correct.
surgeon practices, a surgeon is a surgeon till he or she dies. So there is no shame in asking anyone for help or asking anyone for opinion. Even at my hospital, if I am stuck somewhere, I call my fellow surgeons from different specialities and just say, have a look. Am I going in right? Am I doing it correct? And just that affirmation, yeah, you're doing it correct, we are going in the right direction, makes different outcome for the patient. So in my area, this was the major thing which I had overcome, and it has really helped me a lot. Rest, everything is part and parcel of the complications. Like when we travel on road, there's a high risk of having accidents. We don't stop traveling it. Not everyone who is traveling on road meets accident, correct? So complications are part and parcel of surgery. We should be confident enough and wise enough to handle it on the table itself. And like I mentioned, the first part, every budding surgeon should never have that one word is God syndrome. We are not gods. Things will fall in place then.
Correct, correct. That's very wonderful and beautiful to hear that. And thank you for sharing that so honestly with us. And I think hearing your perspective openly can about your learning curve is incredibly reassuring for the next generation of the surgeons. So thank you for sharing that, doctor.
So much.
So, Doctor, as we wrap up today's session, let me tell you that this has been like a truly insightful conversation. Like your emphasis on preparation, awareness, humility, and continuous learning really reinforces that safe laparoscopic surgery is a mindset, not just a skill set. So, thank you so much for sharing that.
Thank you so much, ma'am.
And to our audience, remember if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay curious and keep learning. Thank you.